Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Welcome to Abby Tyler's Healthy Living, our weekly show. My name is Abby. I'm your Healthy Living NP. How are you guys doing out there? Hope is the weather's beautiful where you are. It is beautiful in my neck of the woods. Welcome again. As you can see, the title of our show today is to be aware of these 7 important men's health issues. It's not comprehensive. There's so many more important men's health issues, but this is the ones I want to talk about today. As you all are aware, or if you're not aware, June is Men's Health Month. So that's when we celebrate and talk about, emphasize more about all the different things, the challenges, health issues, and everything that affect men and also affect the family, because the men are our husbands and our brothers and our fathers and cousins, siblings, and all that. Okay, I started this series last week. So if you didn't get to see it, the Tuesday one is last Tuesday, and we started on how to encourage the men in your life to go get their checkups. So today we're going to be talking about 7 important issues that you need to be aware of. Okay, so I'm just before I start, please share the show, please share the show, please share the show. Okay, the more people that watch it, and sometimes you never know when somebody else could be watching it, and it could be something that they could watch and save their lives. Okay, so give me 2 seconds here. Let me just do this, and I will be right with you. Okay, got my glasses on and ready to go. Alrighty, so let me get my notes. So this nice article, and I built on it and ready to go. Okay, as always, I am a provider, but I'm not your provider. It's my disclaimer. So please do not make any changes to your regimen without checking with your own provider. Okay, so let's get started. Alrighty. So also, I'm trying to like raise some funds so I can put some money back into the program, because I'm bringing you evidence-based information and all that. So if you can give me a start here and there, I can put that into there. So because I pay for the software every month. Okay. So just asking for a little handout. Okay. Alrighty. So anyway, so let's get, most of the, let me just start with this little paragraph for you. Okay. So some men struggle to look after their mental and physical health, which may cause them to skip their checkups and screening. I talked about that last week. Okay. And that can ensure they live long and healthy lives. Men who don't take the health of their mind and body seriously may develop serious health issues. The medical gender gap and its consequences are real, according to the CDC, the Centers for Disease Control, with men dying about 5 years earlier average and women on average. Okay, the good news is, we're here. You have your primary care doctor. You have other people that you can go to, preferably your primary care doctor and all. And if you have to go to specialists, so you can follow up, get your screenings and all that, and so you can live healthy, so you can be around for your family much longer. Also for yourself too. You may not be married or something, but you just want to be around for the people who love you a little longer. Okay, so let's start. So what are the 7 important issues that we need to talk about? Number 1 is heart disease. Okay, more men die of heart disease than any other cause of death. Men can play an active role in their heart by managing their own health risks. I talked about that before. I always say, you want to make sure that you're exercising at least 30 minutes a day, 3 times a week. Also, you want to make sure you're eating healthy as well, low cholesterol food, low fatty foods, especially for those of us who eat rice. And you can cut back on the rice, like brown rice. You can stop eating rice completely. There are other things that you can, make your rice a little more fiber, add more, has a lot more fiber to it, so it stays in you when you eat. It gets out of your body quickly. Do not eat late at night. If you know your family history, if your family has heart disease, people have high blood pressure in your family, that's why it's important that you go to your primary care doctor and you get your screening done and all that. If they tell you have high blood pressure, somebody had a stroke in the family, and it's okay, yes, you have to get some screening. Maybe you get your blood pressure checked. Maybe they want to do an ultrasound of your heart to make sure there's no clogged arteries or anything going on in your heart there. They may want to do an ultrasound of your carotid arteries over here that make sure there's no blockages that could be blocking the air, oxygen and everything, blood flow from going to your brain. That may cause a stroke. It may recommend that you go get a stress test to make sure your heart can, weather any kind of have some people when they have like really bad news or any kind of strenuous activities and all that. Watch your weight, of course. I'm not talking about, bringing shame to anybody saying you're fat or you're this, but keep a healthy weight for your body. So you can go and ask your doctor and say, okay, what is the healthy weight for my body? Again, we don't like put everything in the BMI, the body mass index and all. Just say that you're this tall and you're supposed to weigh this much because it doesn't take into account, like cultural differences, age differences and all that. You're not going to be a 50-year-old man and expecting you to weigh the same as some 19-year-old boy. Okay, or 19-year-old young man, sorry. Okay, so just make sure you're eating and all of that, and watch your stress level. But most importantly, know your family history. Know your family history. Know your family history. And when you start getting to a certain age, even if you're 20 years old, okay, 20, 25, start eating healthy now. So when you start getting to your 30s and 40s, and having children, and your activity level is a little less than what it was before, you're not building yourself up to a disease level. Okay, so there are some things that you can't control. You cannot control your family's history. You cannot control like certain things that affect you based on race and all that, but you can try. You can't change it, put it that way, but you can modify it. Okay, like I always said, modify the modifiables. You can sit there, you can watch your weight, you can watch the food that you eat, make sure you're not eating too late, watch your stress level, don't put too much stress on yourself. You try as much as possible. Okay, and again, make sure you're getting your blood work when you go see your primary care doctor. Make sure you're getting your blood work every year so they can look at it and start trending and say, okay, we're looking at these numbers here. We're looking at your cholesterol numbers. We're looking at your blood sugar number. We're looking at, this, your liver numbers and all that too. We're looking at the salt, all the different things in your body, your kidney numbers. Okay, so make sure that you're getting that. You go into the doctor every year and you get that checked. And they may say, we want to recheck it 3 months from now. We want to recheck it 6 months from now because if we put you on medication, or in case we have to put your medication, and sometimes even have to take you off the medication because your numbers got better. Okay, so it's always important. You want to make sure you get your blood work done every year so they can start checking on that, so you don't get to age 40, 50 and say, oh my god, and then when they tell you that, you go like, oh, I was fine. So, and then all of a sudden, and just remember, certain diseases don't manifest themselves at all. Like I tell some people, okay, the first sign of a heart attack is a heart attack. The first sign of a stroke, for some people, is a stroke. So it's important that you know that, and also learn all the different signs about a stroke and a heart attack. I did a show on heart health, and I also did a show on stroke awareness too. Okay, so try to learn that. So let me go in here and change my banners. So I was talking about heart disease. All right. So make sure eating healthy, watching your stress level, and doing everything to stay healthy because you want to be around long enough to be with your wife and your family. Okay. Okay. Number 2 is cancer. All righty. If I see any questions, any comments there, I'll just go through it. I'll answer that later on. Okay. So cancer it follows heart disease as the second leading cause of death among American men, right? According to the CDC. Okay. So you want to make sure cancer, especially for in men, cancers like skin cancer, prostate cancer, colorectal cancer, and lung cancer. Lung cancer mainly because like more men smoke than women, and also you can also get lung cancer from not smoking. Also, it could be like the environment you're exposed to, the kind of job that you're exposed to, and all that. So if you start developing any kind of cough that hasn't gone away for a while, and you're really thinking about it, not scaring anybody out there, but it's been going on. You've been taking medications, and it's been for a while now. You had this cough that just bothersome. Go get extra doc. You think maybe I need to get a chest X-ray just to make sure I'm not nothing's going on there. And if you're a long-term smoker, especially if you're a smoker for about maybe 30 years or so, I think this is 25 or 30 years, or even before that, talk to your doctor, see if you need to get a screening chest X-ray just to make sure. And if they have to go ahead and do additional testing, but at least that's the baseline to do that. For skin cancer, you're supposed to be staying out of the sun. Men tend to stay in the sun more often. You're supposed to stay out of the sun, regardless of whether you're black or white or not. Make sure you stay out of the sun. Okay, you can still get skin cancer whether you're black, white, and all that too. If for black people mostly, they may miss the signs, and by the time you start manifesting yourself, it may be too late. So make sure you get checked on that. Okay, and colorectal cancer too. Colorectal cancer, you want to be, again, I did a show on colorectal cancer, colon cancer. You want to check when you have your bowel movement every day. Are you putting out any blood? Do you find yourself losing unexplained weight? I mean, you're not working hard, you're not working out, but you're losing weight. When you're eating, you're feeling full too early. It's like early satiety. You feeling for you getting full too early. Food doesn't taste the same way anymore. You're losing some weight, and especially if you have family member that had colon cancer in your family, you want to get tested. Let's say your brother or sibling, another sibling, got skin cancer, colon cancer, maybe let's say age 40. You want to bring that to your doctor's attention so you can start getting tested now. Because right now the CDC is saying that for 45 to 50. But if you have somebody who was diagnosed long before that, because it's the older you get, the higher chance of you getting it, or you get it later on in life. But there are people who have gotten it much younger than that. The first one that comes to mind is the one that played Chadwick Boseman, who played the Greg Black Panther. Okay, he was much younger when he got diagnosed. So it's important that you go ahead and get tested. All right. So tell them, say I had a relative that got cancer early, or mainly get 45 to 50 years old. And for men, I know sometimes it's like, I'm not going anywhere for anybody to put their finger anywhere and in this place. I'm not doing that. No, who wants to do that? I know it can be a little, nobody wants to be getting into that, but it could save your life. Okay, so it's like, again, I told you guys there, if you don't have any family members, like immediate family members, your mother, your father, your siblings, and all that too, there's a test where they can send a box. They send a box to your house. I think that one of them is called Cologuard. They send a box to your house. They give you instructions. You send that. You do everything. You send a specimen over. They test it. If it's negative, you're good for 3 years. Okay, then they can repeat it again. If this is positive, doesn't mean you have colon cancer. It just means that you need to go to your doctor's office and they need to arrange for you to have a colonoscopy, where they actually have to go in there up into your rectum and look in there to make sure everything is okay. All right, so it's important that you do that, age 45 to 50. But if you at a higher risk, then you want to also bring that to your doctor's attention so you can get that. Alrighty, and also for prostate cancer. Okay, when you urinate and all that. Right now, most doctors not doing the PSA level, the prostate test and all, and they're not, because they say the numbers are really high, depending on your age group now, not if you're higher risk. Higher risk meaning you have a family member that was diagnosed with it before. So but average risk people. So because they're saying that as people get older, as men get older, your prostate levels will automatically go up. So it's not just the test alone. They may have to repeat the test again, because some people are getting like unnecessary biopsies and all that, causing a lot of people a lot of grief. So they tell you, okay, we'll do the prostate test. But if you have family members, so you say, okay, well, how would I know whether I have prostate cancer or not? I mean, when you go into the bathroom, or especially, you're not supposed to be peeing any blood. You're never supposed to be peeing blood. Okay. It's not okay, like a little bit, maybe I was straining too much, I was dehydrated, a little bit of blood came out. If you notice that, okay, you really have to keep an eye on it, especially if you're not having any pain. Okay. And then also, if you're having pain, if you find yourself peeing, when you're peeing as a man, you're supposed to be peeing. The stream is supposed to go down directly down into the toilet. If you find it going sideways and you're straining and you find yourself not going that much, it could just be urinary tract infection, or it could also be, enlarged prostate too, where you probably just need to be put on medication that's supposed to smooth the muscles inside your penis and the prostate, and also that way you can pee easily. But it could be something more than that. So it's important that you keep an eye on that, and also know your family history too. Okay. Especially for Black men, you have a higher chance of having prostate cancer and all that, and also sometimes dying from it, because most of the time, again, the health disparity. Some people may not trust the healthcare system, and they may not get the help that they need. And sometimes some people just have the fear of going to get tested and all, because I don't want to know what it is, or maybe it will go away. You think maybe it might go away. Sometimes it's like, okay, maybe it was just a little momentary thing. Nothing happens again. Nothing happened again. But again, you also want to make sure that you get that checked. Okay. So, the early detection saves lives. And also, again, men also get breast cancer. I did a show on, can men get breast cancer? I also get the example of Beyonce's, the singer. Her father had breast cancer, and he did this whole public service thing that they show that, yes, men can get breast cancer. You can get tested for breast cancer too. So if you have that in your family, so if you have on both sides, you can also get that tested too, to make sure. Okay. And as a man, if your mother had breast cancer, you also, when you have children and daughters and all, bring that to their attention too. Okay. So it's important. All right. So again, like I said, get that check. Alrighty. The next one would be diabetes. Okay. compared to women, men have a higher risk of getting type 2 diabetes at a lower weight. So you don't people say, okay, yeah, because I'm skinny, I can get diabetes. You can get diabetes at any weight, okay? And especially type 2 diabetes. So you can be nice and skinny, okay, and you can still have diabetes. All right. So because most men too, especially as you get older, you carry all that fat around your waist there. All right, some women do, but mostly men, that's where they gain most of the weight around there. So when you have that visceral fat, right, that is covering your whole, it's covering your stomach, it's covering your liver, your pancreas, all of that, you have a higher chance of getting that. And especially if you have family members that had on diabetes, type 2 diabetes. Type 1 diabetes is the one you're born with, or you get it during childhood. Type 2 diabetes is one you get later on in life. That was called adult onset diabetes. You can get that early 20s too, but most of the time you get it later on. So it's important. Men have a higher chance of getting that. And when it comes to diabetes and all, it affects your circulation, it affects your circulation, it affects your circulation. That means affected circulation everywhere in your body, okay? Most importantly would be your heart, because when you have diabetes and all that too, that also puts you at a higher risk for having a stroke and also having heart disease and kidney disease and all that. But it also contributes also to erectile dysfunction. Okay, so all of that, because the circulation, when you need the blood over here, you don't have the time for the blood to be going all there. It also affects the blood in circulation in your feet. Most men do always have amputation, because over the period of time you lose the circulation in your feet. It gets you get yourself cut on something, and eventually it gets very infected. That's why you see a lot of people go into that. It also affects your eyesight too. So diabetes can affect your whole life. So make sure you are watching. Go into your doctor's office, getting your blood work done every year. You tell your doctor, get my blood work done. I want to check my A1C. I want to check my A1C to see where I am. And there's a range on there. So your doctor will tell you, okay, these are your numbers. This is the range. This is pre-diabetes. Pre-diabetes, you have a higher chance of going to full diabetes. Doesn't mean, so you want to either stay there, or you want to go more, go stay or get completely reverse that, okay? Because you go to pre-diabetes, and then the next step is diabetes. And that's when some doctors would, depending on your different levels and all, they may start your medication during that time. If you have other risk factors today, your doctor may want to start that, okay? So it's very important that you do that. Ready, manage your weight again. Goes back to exercise and going back to watching your stress, going back to, if they put you on any medication, you want to make sure that you take it, okay? Because sometimes some people have high cholesterol also with diabetes. All of that, a trifecta. Most of the time they have high blood pressure too. So watch your blood pressure, because all of that puts you at a risk of having a stroke or a heart attack. So it's important that you keep those numbers on the check. And if you're already diabetic or high blood pressure, no, you keep those numbers on the check, okay? Again, you cannot change your family history. You can modify the modifiables. Like I said, you can change things in your life. I know a family who the husband got diabetes and all that, and the whole family changed their diet, because you can have daddy eating this and then everybody else eating that. Or if mommy had it, you can do that. Okay, so it's important that you eat healthy. Do that for men, especially because, like I said, you gain all that weight in your belly area. You're covering all your important organs over there too, and your heart is right there. Okay, so for those of you who are just joining us and all that too, for if you're joining us on your Abby Tyler's Healthy Living page, or you're watching from Focus on Liberia or from YouTube, thank you, welcome. Okay, this is June again. June is Men's Health Month, and today we're talking about the 7 important men's health issues to be aware of. Okay, so let me just look in here and see. Look at comments. Okay, so we're going here. Children gaming says seriously, yes, okay, and especially for those of us from third world countries who don't have any history. Yes, that's especially true. It's about me. Most of the times, the doctors, if I go, when I used to go to my doctors too, and they would be like, they'll ask me certain questions. I said, no, no, we'll come from a country, from a culture where people didn't talk about their diseases, because most of the time we attribute things to, like, okay, it was either witchcraft or something else, or some kind of religion, somebody swore you or something like that. So it's important that now that we're here and we're living much longer, so you have your siblings and all, you can say, wait a second, I remember grandma was sick for a time, or grandpa was sick. And especially when you go to family reunions too, you can start talking about those things. So at least that way you can say, oh, okay. And it's not something people hide everything. We're from a culture that they hide everything, something that should be well known. But it's also important too. I don't want to, play that down, because there are a lot. Sometimes you just want to keep your private life private. And there's certain things people may look at that's something that's normal, that yes, you got the disease or you got this. And people who are not too aware of certain things might be like, oh my God, I have to shun this person, or I have to do this, or it must be something that you did, that you have that disease, because nobody in my family has it, and where you're bringing it from. So you may be a little hesitant in trying to share that information. So you have every right to not to share that information, but you want to share, especially with your children, if you have children, because again, your genetic material, you want to bring that. So at least that way they can look out for that. Okay. So again, so number 4, let me get my banners back here. Number 4 is the erectile dysfunction. That is the important thing for men. Okay. It's very important for men. I have had patients before where it's like, okay, yeah, we want to make sure this is okay first before we can start your medication. No, 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 no. No, my heart's fine. What do you have to do all that for? Okay. I just want the medication. Just give me the medication. That's the only time it's like, oh yeah, I just want the medication. All right. So it's important that, erectile dysfunction mainly is like when you cannot get erected to in order to perform sexually. So basically, it's different when you were just tired and exhausted, but you start noticing that you're not getting, because I always ask my patients to, you have a problem getting erected, or you having a problem in sustaining the erection. Okay. And that's when we start talking about different things. But the most important thing is erectile dysfunction you start getting that later on in life, but some people get that earlier, and maybe even like in the 30s or the 40s, sometimes in the 20s, and all. Then most of the time too, it has something to do with circulation. Again, going back to diabetes, diabetes can affect your circulation. It could also be something going on with your heart. You have a blockage in your heart that's indicating that something else is going on there. Okay, so you're not just coming to the. And then also we want to make sure you're not having anything else that's going on, any kind of lump or mass or anything that's going on that indicates another disease. So when you come to get, you want to bring that, concern out to your doctor and all. Sometimes some men get so embarrassed and they might whisper it. It's like, okay, that's okay. You don't have to whisper it. We can have this conversation. I'm a professional and I'm responsible for taking care of you. So yeah, just bring it. And they might say, okay, let's do some blood work first, just to make sure you don't have any low blood anemia. Okay. And we want to check your heart, especially if they give the medication to you. And sometimes it also could be like you're taking certain medications for certain things that can also contribute to that too. So we'll look at the list of your medications, evaluate it and everything, look at your medical history, look at what the kind of work that you do. Have you ever been injured in that area before that may have, sustained long-term injury and all? So we have to ask you all those questions. So it's not just giving a medication. And if you feel this way, and especially if you're in a relationship and it's causing the problem in your relationship and all that, bring it to your doctor's attention. There's so much more we can do about that. But the most important thing is we want to make sure that your heart and everything is okay. All right. Because a lot of people will buy like stuff right online. Oh yeah, I got this online. I had a patient who said, if you don't want to give it to me, I'll just go right online and buy it. Well, you get that online, but the person that's selling it to you, even if it's coming from another medical source and all, nobody's paying attention to your heart. They're not doing your blood work. They don't know your particular situation. So if you run into problems where, you start doing that, and next thing you know, you start having chest pain and all the other stuff, there's some people who have certain illnesses that cannot take any medication for erectile dysfunction. Okay. And I understand that can cause a problem in relationships and all, but bring it to your doctor's attention, and your primary care provider can do a lot of different things to make sure you're well. And also then if we need to send you to see the urologist, okay, then the urologist can go ahead and do more testing and make sure nothing else is going on there. But first thing, you want to make sure your heart is okay first. Okay. Like even when they do the commercial on TV, first you want to make sure your heart is okay for sex. All right. So that's important. Okay. Number 5 is the HPV, and that's the human papilloma virus, and sexually transmitted infection. That's also STDs. All right. So most of the time, most of the guys, yeah, especially younger girls and younger guys, when they had the pediatrician, there's the different vaccine that you can take that now. Okay, they say, well, men can get the HPV virus. I thought it was just women. Yes, men can get it also. Okay, and you get that. You can get that. Let me go. Yeah, HPV vaccines can prevent infection. Most of the time, people can clear it and all that, but sometimes you end up having it. Okay, you can use condoms to protect yourself also, and also for your STDs too. But some diseases, the condoms don't help at all, like things like genital herpes and all, because just the way that it doesn't cover your whole body there. Okay, and you're rubbing up against each other, so it's important every time. If you're not in a monogamous relationship, make sure you're protecting yourself every time. And also when you go to your primary care doctor too, most of the time that's also part of your routine blood work now. So we check for all these different and major health STDs and STIs and all. We check for that because some of them you can treat it with medication, some antibiotic, and sometimes you have to go on long-term medication for that. So it's important because you don't want to be a young person and you get some disease and all, and then you go ahead later on, you get married and then give that disease to the person in your life. And there's nothing to be embarrassed about. Okay, there's nothing to be embarrassed about. So you want to make sure you get yourself checked. You want to get yourself checked because also, if you're in a relationship where you're doing oral sex and all, where if the other person has the virus, men get that, they also end up having throat cancer and all. So that can be very serious. All right. And men can also, they can have the virus in the body that can cause like severe infection too, and other leads to penile cancer and all. So it's important that you make sure you protect yourself each time, every time, and get your blood work checked just to make sure early detection can really save life. Okay. So the next one is number 6, low testosterone. Now, testosterone is the enzyme, is the, sorry, let me get some water in my throat. It's a little dry. This one is on your body, where as a man, it helps you with bulk up and everything, and it makes you strong, and also it's supposed to help with your sex hormones and all that. Some people, as they get younger, as they're younger, they start getting, the testosterone level, that which is abnormal because your levels are supposed to stay at a healthy rate until as you start getting older, it slows down your sex drive, because sometimes you be like, you just don't have the desire. Again, it could be some other medications you're taking. And sometimes some people just have a low testosterone level that can affect that. That can also affect a relationship as well, because, your partner could be saying, well, maybe you're messing around. That's why you don't find them attractive, or so many other things that could be going on and on. So it's important that as you get older, it starts like in the 30s and starts you getting older. So, and some people never had that problem because some people can just go on until like they drop dead. Alrighty. So, but it's important that if you find yourself doing that, alrighty. And again, like I said, it may be based on some of the medications you're taking, or just that's just your normal drop. Talk to your doctor about it. There's so many tests that we can do for that. And also we can put you on some medication that can help you along the way. You don't have to sit there and suffer in private or affect your relationship. That's something you just bring that up. I'm coming to say, okay, they may ask you when you call to make an appointment with your doctor, okay? And they might ask you, why you calling to make an appointment? Oh, I just want to get some blood work done. And you don't have to go into details and all that. And then when you come into the room to talk, most of the time you come into the room to talk to us, and that's when we talk about it. It doesn't have to be, oh, no. It would just be like, okay, this person's coming to have the blood work done. Sometimes that's all I know until I go into the room and then I find out that this is what they want done. And it's, don't be embarrassed about it. You're talking to a professional, and we have to take care of you. And taking care of male patients is taking care of all of that. Okay, so of course we want to check with that, and then we need to send you to the urologist, and also we'll be checking for everything. Most important thing, the bottom line is always to make sure there's nothing major underlying diseases going on, and so we want to make sure that you're healthy. Okay, so you can go ahead and we can say, okay, she's doing this and she's doing that, and we want to do that. Make sure you have a healthy sex life or a healthy married life, healthy relationship life, and all. But at bottom line, we want to make sure there's nothing major underlying going on. Okay. So, and then the last one here is depression, men's mental health. Okay. And I put that depression, but there's more to men's mental health, just depression. Because when we say mental health, it's like when we say mental illness or mental health, and people think like, oh, it's just a bunch of people running around and getting crazy and doing this and shooting up the place. No, it encompasses a whole umbrella of different diseases: anxiety, depression. It could be bipolar, it could be schizophrenia, it could be, and most of those things like depression or anxiety, it could be something that's chronic, or it could be something that's episodic. Maybe you went through something. Maybe you went through a death when you were younger, a death of a family member, a death of a pet. Maybe you went through the divorce, and so many different things. At work, things could be going on, different things that you see in the news. Other people perceive other things and take into, take and absorb all that information into the body. That can also lead to depression. Or maybe you just naturally is somebody who has depression that you need to get checked. Okay, so, and especially for Black men too, you want to get, bring that up for generally for men. Okay, you want to be macho, you want to be strong for your family. And most of the time when men don't get that check, or men don't bring it up, and most of the times we don't pay attention to men because we're like, oh, be strong, you were raised to be strong, men don't cry, men don't do this. And sometimes they bring this toxic masculinity into it, so you're either very strong or you're like you're acting this way, and only women do that, only little girls cry. And also we put all this on men from the time they're little, and they get to a point where when they actually need help and they can't get the help, and next thing you know, they're there and they're, God forbid, they're committing suicide because they don't know how to voice their complaints. They don't know how to verbalize the kind of problem they're going through. I need help. You tell them, I need help. And if it gets to the point where you find yourself being very depressed and feeling suicidal, or homicidal, it's very important. You call 988. That's the number. If you forget 988, just call 911. Okay, but always bring that to your doctor's attention. And when you do go see your doctor too, we do the whole screening to see where you are and bring up that. There's many different the health professionals, mental health professionals, and all. You talk to your. Sometimes the list can be a little difficult to get onto, and sometimes it can be a little pricey because not all insurance company would pay for all of it. But there are many ways, and then sometimes you don't even have to go into the office to see the psychiatrist or the psychologist. You can do a lot of people do telehealth now, so you can do that also. Okay. So there's so many people you can look on the back of your insurance card and the member services, and then try to get one of those. Try to get it. Tell you, so what are the mental health providers in my neighborhood, or in my city that I can go to, but I need help. Okay, there's people you can talk to. People in your church. The people in your church who are trained in counseling. Don't just go talk to anybody. Somebody in your mosque or in the synagogue. People who are trained. There are a lot of people who are trained in counseling also in the church, and you can listen to them, and they're supposed to know when you need to get help. Okay, don't just sit there and just tell you this. You can do this. You can do that. So make sure you go get the help that you need. Okay, your family deserve it. You deserve it. You deserve to be happy. And if they put you on medication, it could be just for a short period of time and say, okay, we'll put you on this medication for a little bit. And then when you get to the point, we can take you off. Or you may need to take that medication forever. Just as much as you can say, okay, I have a headache, I need to take this medication forever. Or I have diabetes, so I need to do that. When your head needs help, it needs help. Okay, there's nothing to be embarrassed about. You don't have to tell anybody you're taking the medication. I mean, of course, if you're in your family, your spouse and all that, or your significant other, yes, you want to do that. But it's important that you do that, okay? And take the medicine and don't let anybody shame you out of it. All right. Because mostly people even your own doctor, other people who are your boss, other people, most people, they take their medications. I mean, it's like they take their whatever for anxiety or diabetes or bipolar, whatever it is. All these people you see walking around here, they take their medications. A lot of people have mental health issues. They take their medications and they live productive lives. So don't think it's like, oh, just those people taking medication, or I must be crazy if they tell me doing this and nobody else is doing that. You don't know that. A lot of people, a lot of regular people take medications that's supposed to, help them along the way. Okay. So finally, again, you want to take preventive and proactive care no matter what the issue you might face and all. Make sure you're taking most important thing like being a primary care provider is prevention, prevention, prevention. Going to your doctors, getting your blood work done, like I said before, getting your checkup. If they tell you to follow up, because a lot of people, when their blood pressure is high and I tell them to follow up, they don't. It's like, okay, I want you to come back in 1 week. Or sometimes I may say, okay, you have a blood pressure cuff at home, take your blood pressure and call it in to us. Okay. Follow up, follow up. And I know it's not, sometimes will work and all. I also talked about telehealth the last time. So there will be times so you don't have to come to the office. You can just get your test done and then, go from there. Okay. So women, women, sisters, mothers, siblings, and all that too. These men, of course, you want to take, you want to take your own control of your own health and all. So this Father's Day going to be Father's Day on Sunday. So it's important that you do this for yourself and you do this for your family. This is no longer where you can say, oh, I'm going to be shamed and people are going to know this and people are going to know that. You don't have to tell your business with anybody. That's why sometimes when I see a lot of people watch this show, and sometimes I'm like, wait a second, not too many comments and all that, but most people don't like to talk about their business and all. But the most important thing is please share the show. Okay, just share the show, so at least that way, because if I'm friends with you and you're watching the show, but other friends who are not friends with me could see the show and they could help somebody. Okay, so the most important thing is share the show. Alrighty, so I hope you all what I said today has helped. Please give me a thumbs up. Please give me a thumbs up. Okay, I take a lot of time when I put my notes together. I get different notes and then I put my own practice and everything to it to be able to bring you evidence-based information every Tuesday that's going to help you or your family member. Okay, so all I'm asking is please just give me a thumbs up. Please share the show. And again, like I said, I put money into this when I have to pay for the software. Please give me a star. If you don't want to, the most important thing you can do for me is to share the show. Okay, so please share the show and give me a thumbs up. Okay, as always, You can leave your comments later on, and I go back and I read the comments. And if I have to answer any questions, I do that too. Okay. So thank you all for watching. Thank you all who are watching right now. And thanks to all of you who will be watching later on. And I really appreciate it. Focus on Liberia, YouTube, and the other places that I share the show to. Okay. So please share the show. And I hope you all have a beautiful Father's Day this weekend. Beautiful, beautiful Father's Day. Weather's supposed to be really nice. Okay. So have a beautiful Father's Day. And if you haven't liked and follow Abby Tyler's Healthy Living page, if you're watching from other forums, please like and follow, because I do put up a daily video every now and then, maybe 2 to 3 times a week, and it's healthy video, so you don't want to miss that. Sometimes I just put up a regular post, so please like and follow. If you have family members who just do frequent YouTube, I'm also on YouTube under the same name, so you can look there too. Okay. So thank you all for watching. I really appreciate it from the bottom of my heart. I really appreciate it. I wish you all the healthy men in your lives, and enjoyed Father's Day to all fathers, alive fathers, heavenly fathers, father figures, and all that too. Thank you all for watching. I appreciate it. Thank you so much, and good night.